Stakeholders in the food and nutrition sector attending the forum also discussed the developing country-level recommendations in response to the result of the Cost of Hunger in Africa study. Dr. Mbye, the Deputy Executive Director of the National Nutrition Agency, said the study was necessary considering previous data on the country's nutrition.
The Gambia is classified as a low-income food deficit country by FAO, which produces only 50% of the total national food consumption needs. The 2016 Comprehensive Food Security and Vulnerability Analysis revealed that at the national level, about 8% of the total population is food insecure or vulnerable to severe food insecurity during normal times. According to the Integrated Household Survey of 2016, 55% of the population is food insecure, and 35% of the population will not meet their daily food requirements of 2,400 kilocalories.
Good nutrition is a building block in the foundation of human health and development, thus the need to invest in the nutrition sector, according to Dr. Mbye.
It is therefore prudent for us to increase investment in nutrition to prevent brain damage, improve health, and gender equality, and drive away poverty, because the underlying problem of all this is definitely poverty. We increasingly know that good nutrition is better business, and returns from programs for nutrition far outweigh their cost.
Sadaf Sadar of the World Food Programme Banjul office said in addition to national benefits, the Cost of Hunger in Africa study is also the first attempt to quantify the economic burden of malnutrition on the continent, as well as the socio-economic consequences of child undernutrition.
The Cost of Hunger in Africa studies represents the first systematic attempt to quantify the economic burden from malnutrition across the continent. It demonstrates the far-reaching social and economical consequences of the child undernutrition. It showcases continental efforts to build a body of the evidence for informing global, continental, and national efforts on increasing financing in nutrition programming and policy formulation.
The program manager at Nana, Malang Fofana, gave a brief genesis of the study.
Sometimes in April, May 2018, we as a country, through the Office of the Vice President, wrote to the AU to request for the Gambia to be included in the countries that will be conducting the COHA study within the continent. Because COHA as a study was adopted in the Malabo Declaration for all African countries to conduct this study.
With the statements made and the statistical data revealed by experts, it is evident that child malnutrition, if not addressed, has the potential to impair the child's capacity to develop cognitive skills, thus affecting their development aspirations and that of the country. Mbye, GRTS News.